Senator Kane is walking in as his time comes. Would you like a moment to get yourself
Mr. Chair, if anyone else hasn't asked questions, I would rather that they go before me, or has
Well,
everyone
Senator
asked?
Johnson has already had his round, but he's been waiting patiently for a second round. So I'd be more than happy to give him 5 minutes and then turn to you.
That would be
and we'll
great.
wrap. Let's do that.
Well, really, just
Get
to
an
make,
extra round, Senator Johnson.
I appreciate that. So just to make the point, Senator Brown was talking about revenue percentages and spending percentages. Year 2000, total spending was 17.7% of GDP, according to Mr. Capretta's Table 2. Revenue was 20%, so we had a surplus. This year, 2022, revenue was 19.6%. Those are pretty historic highs. As Senator Brown, generally we're somewhere between 17 and 18%. So we're historically high. By the way, and that 17%, 18% is regardless of what the maximum tax rate is. I mean, we've had tax rates in excess of 70%, and you're still raising about 17, 18%, because, again, we have such a broken and complex tax system, all kinds of loopholes. The government can only collect X percent, and kind of 20% is sort of the top level right there. But the difference this year is spending is 25.1%. So again, when we had a surplus, spending was 17.7%. Now that we have massive deficits, spending is up to 25.1%, which brought me to the conclusion that we better start prioritizing spending. We just can't continue to spend a quarter of our GDP through the federal government, because we'll never be able to raise the revenue. No matter what you do, you just can't get 25%. You can't squeeze that out of the American taxpayer. So we better recognize that reality. And again, I would point out that the solution is what Senator Brown was talking about is, how do you reform the healthcare system, and as I was talking about, to reintroduce consumerism? And I'll say, separate out the two different types of spending. And I wouldn't mind Mr. Capretta talking a little bit more about that. Medical services. I mean, the routine care that we all go in, that, for example, Medicare. We got a waiver during COVID for telehealth that then expires, and all the medical providers in Wisconsin are saying, can you extend that exemption? Because telehealth worked really well. Well, why would they even need an exemption? Because it's government run, it's bureaucratic, and makes no sense. So when you have government regulation, government bureaucracy, it just prevents providers from being imaginative, showing some real progress in terms of how to deliver things more efficiently. Again, what this free market does. Best possible price, best quality, best level of customer service. Again, that's what the free market does. Why don't we introduce more of that? Ms. Capretta, just real quick, would you like to respond to that?
Yeah, I think we're on the cusp of maybe doing some of that with the price transparency requirements that have been put in place. Some of it might be statutory if the Congress moves ahead. But there needs to be more standardization of packaged benefits. And by the way, I would agree with the comment that not all of healthcare is going to be subject to consumer discretion. There are a lot of studies of this, and it's going to be probably about 40%. So there's some big ticket items where you can't shop.
Okay, so real quick.
But there are some things where you can.
You're saying about 40% would be kind of what you earlier referred to as medical services.
Yes.
And then then 60% would be, again, the catastrophic care, the things you need insurance for.
Yes.
Correct?
Correct. It would be big things where it's not really a packaged, discernible item. It's going to be some ongoing event with unknown outcomes. And so you're going to spend a lot of money, and you can't really shop for it.
Look, you mentioned transparency. I know there's a lot of talk about that. Again, you introduce free market competition, you automatically get transparency because consumers are asking, what does it cost? My concern about government-regulated transparency, it'll be fudged. I mean, it's just not going to work as efficiently as a free market system that just demands price transparency. And that's nobody knows what anything costs in healthcare. I mean, nobody knows.
The only point I would make there, Senator, on the other side is that when a consumer wants to buy a surgery, for instance, they need to have the surgeon in, the anesthesiologist, the radiologist, the diagnostics.
Yeah, but
they need a packaged benefit that they can figure out and price.
That's the insurance side of the market. That's the insurance side. The example I use is eye care. People do pay for that out of pocket. So LASIK surgery has dramatically come down in price because consumers know what it costs. They understand the benefit. If we get more of healthcare in that model and then look at the insurance model, and again, prepackage it, have it very standardized. When I was in business, it drove me nuts buying insurance because you always had to look at, well, what does this plan exempt? Made no sense. I mean, they just exempted certain conditions to save money. So there wasn't transparency in that insurance, and that's where I would definitely go toward specific models. This, coverage A covers all these things. Coverage B covers this, and have that standardized. That you would require government regulation.
I'm very much for that, yes.
Okay, good. Well,
With
there we
that,
go. We
we
got some
turn-
solutions here, Mr. Chairman.
With that, we turn to the patient, Senator Kane.
Not patient, I needed to adjust my brain into the right committee. So thank you, Senator Johnson and Mr. Chair.